Hi everyone, it's Marianne Murphy. I am a Global Amare wellness partner, emotional wellness coach, speaker, writer, and mental health advocate. So this is day 7 of my 30-day journey with the Amare Global's FundaMentals pack. And today I want to focus on the third um, product in that pack, which is Menta Focus. And this is a proprietary blend of several ingredients: pomegranate, apple phenols, French grape seed extract, New Zealand pine bark, rosemary leaf extract, oregano, clove, sage, and tule. And a lot of great clinical data on this. Pomegranate has a really high ORAC value, antioxidant value. And one of the things that impairs our memory is oxidative stress. So taking supplements and eating a diet that's rich in antioxidants can help reduce that inflammation that's caused in the aging process. So they have some good clinical data on how pomegranate can help with improving short-term and long-term memory. The other ingredients that were put together in this formulation also have been found in human clinical trials to increase concentration, attention span, alertness, creativity, cognition. And I'm going to say would say that's a fair what I'm experiencing. I'm still having trouble with my sleep. As you can hear, the sinus infection is still hanging on really strong, even though I did the 5-day Z-Pack. Still symptom-free in terms of a yeast infection. So, like I said, really impressed with the product so far on that front. And usually when I'm experiencing this kind of continuous sleep deprivation, insomnia, I have very poor concentration, high irritability, forgetfulness, easy prone to making mistakes. And although I'm still experiencing that, I don't feel that it's as strong as it really should be, or that I've experienced in the past. So I do feel like this product is helping me from a standpoint that even though I'm exhausted, I'm still getting tasks done on my to-do list, where in the past it may just be like, I'm gonna just lie around. I may not still be able to sleep, but I just don't have the mental capacity to focus on any intense activity. And I've been kicking ass this week in terms of moving forward in intentional action towards my goals. So I'm really kind of happy with that. And I've also even had the energy to just go and exercise. Yesterday, between work and just personal exercise, I walked over 8 miles, according to my app that counts my steps. So I was like, all right, hopefully this is going to wear me out and I'm going to get my sleep back on schedule. I do plan to start the Amare's sleep product next month. I wanted to kind of not introduce too many things at once. Some of you may or may not know that I do have an area of expertise in vitamins and supplements. I worked for almost 4 years for Life Extension Foundation out of Fort Lauderdale, and I was a health advisor for them. So in the time period that I was with Life Extension, I talked to over 20,000 people about their health care and vitamins and supplements and how they may help them. And something that I always hear about that, there's a disclaimer on every nutrient bottle you'll ever see, and it says, these statements have not been evaluated by the Food and Drug Administration. The product is not intended to diagnose, treat, cure, or prevent a disease. And sometimes when people read this, they think, oh, well, if it's not FDA approved, I feel nervous about taking it. And if anything, that should maybe increase your confidence in taking it. The FDA does not have a great track record in protecting us. They often approve many medications. That's, drugs and food is their area of regulation. And there are often recalls on both, as you can see in the news all the time. The FDA has its place, but they are fallible just like any other organization that is run by human beings. And something to know about the FDA as well is that part of their funding comes from pharmaceutical companies. So when they're trying to get approval for a medication, part of their funding in order to have staff comes from big pharma. So to me, there's, a bit of a conflict of interest there. It's kind of like if the police department, if part of their budget came from the mob, there's a bit of a conflict of interest there. So not saying the FDA is bad, I'm not saying that they're crooked. I'm just saying this idea that they are some kind of an infallible authority, and because they don't, this is vitamins and supplements, it's not in their purview. So that kind of statement really is really a neutral statement. It really should be more like, okay, this is not under their purvey, versus, oh, it hasn't been approved, so I shouldn't take it. They haven't looked at it because it's not in their purview to look at. Just much like if you were to go to a psychiatrist, he's not going to be inspecting your feet. His specialty is not feet. That's a podiatrist. So it's kind of like that. This is just vitamins and supplements don't fall under their purview of expertise or of what they're intended to regulate, and that's food and drugs. So just wanted to give you that tip. If you ever have any questions about vitamin and supplements in general, I am a good resource to reach out to. Of course, I now work for Amare Global, so you may find it, oh, well, can she give me unbiased information? And I can. There's plenty of products out there that are high quality, and Amare Global is one of them. And certainly if you are taking something else that you really like, there's no reason to change it if you're getting the benefit that you're seeking from it. For me, I was all set to go buy a bunch of supplements when I was considering becoming a wellness partner. And, I did a cost analysis and I looked at, well, how much am I going to be spending? And wow, I'll be spending about the same amount of money to get enrolled here. And not only does it have some of the nutrients I'm planning on buying, but it has even more than I'm planning on buying for the same amount, and then the opportunity to make some money. So that was kind of my process in figuring out whether to join Amare Global, and that was after doing my due diligence of looking at their technical sheets for their products to see what clinical studies, what scientific evidence they were basing these formulations on, seeing the proprietary sourced ingredients that some of them I'd seen in life extension products. So anyway, that was part of my process in seeing if Amare was a good fit for me. And I always tell everyone that there's truth in all information, but not all information is true for the individual. There's always an exception to the rule, even if you have a very good study. And a good study would be lots of people. We're talking tens of thousands of people, double-blind placebo, over a course of many years. That is where we can really kind of derive a clinical significant answer. One study, and we see that all the time, the news reports these one studies, eggs are good for you this week, eggs are bad for you the next week, coffee, same thing. One study really doesn't mean anything. One study that has a certain result just is really, that's interesting. We should do another study. That's all that one study means. But when you're evaluating whether it's a food, a nutrient, or a drug, you want to look at the breadth of evidence. So you want to see that there's been multiple studies. And these studies aren't just for a few months long, but longitudinal over many years. And then when we have this breadth of evidence, that's when we can start feeling more comfortable in our conclusions. But even with that, there will always be a human exception to the rule. And what that means is, just because it doesn't apply to you doesn't mean that it's bad science. You're the exception to the rule. And I'll tell you, in talking with 20,000 people, I talked to quite a few exceptions to the rule, and I myself am one. Melatonin, that is a hormone that our own body produces, but it's also a supplement to help with insomnia. It's supposed to help you sleep. It actually wakes me up. So, and I've not the first person that I'm aware of that has this problem. I've talked to about a half dozen people who have the same reaction to melatonin. So again, the goal for me as a health coach is to help people become an expert of themselves, so that anytime they come across new research that they find interesting or compelling and are considering taking a supplement or a medication or a new diet regimen, that they can filter that information through the lens of their expertise of themselves. I'm a big believer in partnership with your healthcare practitioners. They have their expertise, which is this knowledge they've studied, but you need to come in with the knowledge and the expertise of you and knowing your body and what works and doesn't work for you, or at least a really strong curiosity. It takes time to get to know your body and what works and doesn't work for you. And sometimes it's truly just trial and error. You have to have a willingness to try. And over time, you kind of get to know, like for example, for me, can't take steroids. They just mess with my mood too much. Any benefit from a steroid, the risk and what it does, putting me at risk for a manic episode, no. So here you can, again, this sinus infection, they wanted to give me steroids. And I said, nope, can't do it, won't do it. And, the doctor was like, why? And I explained, I have bipolar disorder. Steroids put me at risk for mania, and my mood is kind of upticking that way currently. So that's a no-go. And really, the last time I took steroids, I always joke that, I'm Mary Ann and then there's Scary Ann. And steroids and Scary Ann, that's really high octane Scary Ann. We really, nobody benefits from when she arrives. So, so I know that about myself. I've become an expert about that myself, and I can control that conversation with the doctor and say, nope, steroids aren't an option. What else do you got? What else can you suggest? And so it becomes then a synergistic relationship with your doctor and other healthcare professionals to help you get to your best version of your health. And that's, fluctuating. Our best self fluctuates from day to day. It's not constant. Excuse me. But anyway, I think that's enough today. It's kind of gone on longer than I expected. But again, this is the Menta Focus. So this is the third of the 3 products in the FundaMentals pack. And if you have any questions, drop them in the comments. Feel free to reach out to me at coachmurphym@gmail.com. If you'd like a sample of our sleep or mood product, you can request one too in that email. And I will put also the contact information for me in the comments or in the description section. All right, I hope you have a happy Sunday fun day, and I look forward to talking to you tomorrow. Take care. Bye.